shortness of breath, bluish lips, confusion. When these symptoms appear, dial 911. It is important to remain calm and clear when talking to the operator. If possible, use the SBAR technique when providing information, which is an acronym for Situation, Background, Assessment, and Recommendation. Here's a sample of how to communicate to a 911 operator using the SBAR technique. 911, what's your emergency? Hello, my name is Anna. I live in 345 Orange Avenue in Cypress, California, and my phone number is 4567. I'm calling for my grandpa Steven. He's tested positive for COVID 5 days ago. He's been coughing since his diagnosis, but his symptoms worsened about 20 minutes ago. He's currently experiencing shortness of breath and his lips are pretty much blue. He's sitting on the bed in the semi-sitting position and he's still responsive and coherent, but he needs to be transported to hospital as soon as he can. Our house is easily accessible and my sister's outside waiting for the paramedics to arrive. Please let me know what else I should do. In general, paramedics have modified their approach to care following the surge of COVID cases. They have added a few infection precaution protocols such as the standardization of the use of personal protective equipment. Providing thorough information to the operator could definitely help alert the responders and expedite the response.
One of the things that's changed is their need for PPE. So they now are more constrained in the sense that they can't just go in with gloves. They now have to go in typically with gloves and a mask and usually an apron, a gown of some kind. And because they live in the fire station for 24 hours at a time, sometimes longer, and their quarters are fairly close. So they really have to be careful. And so they've had to change their protocols, so they need to wear this material. And when the incidence of the disease was very high, it's come down now some. You just don't know who's got what. So a lot of times you have to wear it almost on every call if you're transporting a lot of patients with COVID, because sometimes you get a call for a week or for some other vague complaint. You don't really know what it is. You think, well, it's not COVID. And you go out there, and the reason they're weak is because they're short of breath and have a fever and they have COVID. So it's a little late to figure it out after you've already gone in there. So you have to sort of gown up beforehand, and that's kind of been more of a hassle. It's constrained them somewhat. And then depending on the situation, if your PPE are limited, you can't afford to send in 2 people to every case in full PPE. So what they've started to do is instead of sending in the usual 2 people at a time, they'll send 1 in full PPE to make an assessment. And if it looks like there's a COVID situation, then they, depending on how sick they are, they may gown up a second person and send them in. If the patient's relatively stable, then they won't. They'll just use the 1 person that's fully gowned up to do the assessments and everything else. And then when they put them in the ambulance, that 1 person will go with them and the second paramedic will ride in the cab. And then they have protocols that they've added to increase ventilation, make sure there isn't communication between the air that's in the front part where the driver sits and in the back part where the patient is. So there's been changes in protocols, in the amount of PPE they use, and in the way they approach patients. So there's all been and they've all had substantial impacts on the cost and on the time.
All patients arriving at the emergency department are triaged. Triage is the process of sorting patients according to their conditions. Those with known or suspected COVID infections are immediately isolated and treated away from others. At the peak of the pandemic, some hospitals have set up emergency units where patients with known COVID infections are dropped off by the paramedics. Some hospitals have innovated their approach to patients on cardiopulmonary arrest to minimize transmission to healthcare workers.
When do COVID-19 infected patients know whether they need to visit the hospital or quarantine at home? So many people don't have intense and severe symptoms. When they do, catch COVID-19. As a nurse, I would tell people you need to visit the hospital, go to the emergency room, urgent care, call your doctor's clinic. If you start to have difficulty breathing, if you feel like you get winded from very small things, like walking up a flight of stairs, if you feel like you can't get enough oxygen in, if your fevers are so high, maybe like above 102 degrees, and Tylenol is not bringing your fever down, I would call the doctor's office or go to the emergency room. If you have like a mild fever, you're probably fine. If you're able to keep food and liquids down, that's good. You probably don't have to go to the hospital. If you have like a mild cough, that should be fine too. You should just honestly stay at home. Or if you feel just a lot of fatigue and tiredness, you should just stay home. But if you just feel like you can't get enough air to breathe, then you need to go to the emergency room.
A patient room in the ICU or telemetry unit usually has an anteroom that serves as a place where healthcare workers can don on and don off their personal protective equipment before and after caring for their patient. PPE would consist of an N95 mask, a face shield, a gown, and a pair of gloves. Healthcare workers must be fit tested for an N95 mask prior to their duty assignment. If they don't pass the fit testing, they may use an alternate equipment such as the powered air purifying respirator. At the peak of the pandemic, hospitals would designate a nurse to act as a safety monitor in ensuring proper wearing of PPE to ensure protection of healthcare workers. A COVID patient who is severely deprived of oxygen may be hooked up on a ventilator via invasive intubation. This can be accomplished by sedating the patient and inserting the endotracheal tube. Since cardiac complications are common, COVID patients are often attached to heart monitors. Patients can also be placed on antiviral therapy called remdesivir, transfused with convalescent plasma, and could be placed on bowel management if needed. Another effective technique is prone position. Patients are also placed in a prone or face down position several times using a rotaprone bed or by manual adjustment with a team of nurses guided by the respiratory therapist cradling the head of the patient. This position relieves pressure and weight, allowing better expansion of the back of the lungs, and enhances the draining of secretions, which may ultimately lead to better breathing.
So, what are some common treatments for a person who has COVID-19? So, at the hospital, like I said, there's no cure to it. The only thing that we do are perform interventions and administer medications that help with the symptoms of COVID. So some medications that we administer include blood thinners, just because we've noticed that amongst those who have COVID, their clotting time is a lot faster. So we administer them blood thinners just to prevent any type of clot formation that could lead to a stroke, a heart attack, or anything like that. Another thing that we do is we administer steroids, just because steroids help the lungs expand. Other things that we do, we also administer some supplements such as vitamin C, D, and Zinc, which can also be taken by people who don't have COVID. So that could also be used as a preventative measure to keep your body healthy, to prevent you from contracting the virus. Other things that we do that are extremely popular amongst all hospitals worldwide right now is putting patients in a prone position when they are still experiencing shortness of breath. So that means having them lay on their belly, which helps them expand their lungs more as well.
Among the struggles that many healthcare workers dealt with during the initial stage of the pandemic was the lack of supply. At that time, the supply of PPE was inadequate, but they had to use them for an extended period. The change of treatment protocol was also a challenge as the medical community was trying to find the best therapeutics to improve outcomes of care. The most heartbreaking experience that healthcare workers have to endure is seeing the families being separated by the disease. With the last physical interaction occurring at the time when the patient was taken from his or her home by paramedics, oftentimes the patient would die away from their families. Healthcare workers, nurses in particular, would do their best to facilitate electronic communication between the grieving family and the patient, and also much needed care at the time of death. Although loss and grief is a common experience for healthcare workers, COVID made this instance more frequent and even much more difficult to cope with due to physical distance. Grief does not only embattle the families of patients who are left behind, but also the healthcare workers who bear witness to great human tragedies.
Today was a really rough day. It was a really rough day. It's a really rough shift. I don't know. I just feel like there's only so much anyone can take. I'm tired of walking into rooms and your patient's dead. You just walk into a room and there's a dead body there. Sadness for my fellow nurses, and sisters and brothers that have lost their life taking care of people. I feel bad for the patients who aren't living, especially the ones that are hanging on by a thread. I don't know. I just feel like people think just because we're like a healthcare worker that we are somehow immune to this, and we're not. I cried the whole way home with the Uber tonight, and the driver was like, "Ma'am, are you okay?" I was like, I don't think people understand how stressful this job is. I wouldn't trade it for anything in the world, but it's so stressful. I wish sometimes people could just understand to give us a break. Everyone is trying hard. Everyone is trying hard. We all are.
Much of the United States is headed towards a decline in cases amidst the introduction of a new strain. Regions such as the UK, France, Lebanon, Japan, the Philippines, and much more are currently experiencing a rise in cases with the introduction of new strains as well. A strong vaccination rollout is a key component to stabilizing infection rates, not only in the US but also other countries deeply impacted by COVID-19 that can help health professionals restrict the spread, especially giving us hope for signs of recovery.